our studio today, we are honored with a world-renowned doctor, Dr. Rida Aram. He is a thyroid expert, a brilliant teacher, a researcher, a patient care provider, a professor of medicine at Baylor College of Medicine in Houston, Texas, a medical director of the endocrine laboratory at Methodist Hospital in Houston, a former chief of endocrinology at Mentor Hospital in Houston, and an editor of many prestigious medical journals. He is the author of the Thyroid Solution Breakthrough and is a pioneer on the thyroid. Welcome, Dr. Aram.
Thank you very much, Dr. Don. I'm very excited to be here and to go over some important aspects related to the thyroid gland. In my mind, the thyroid is one of the most important glands, obviously, that regulate the functioning of our body as well as our mental wellness. I have two objectives today. The first one is perhaps to provide you with a general, simplified overview on what the thyroid gland does in our system and how it contributes to our physical and mental wellness. And my second objective will be to teach you and teach the audience the main components of a mind-body program that I have designed several years ago to make my thyroid patients reach and maintain their overall physical and mental wellness. I had realized years ago that conventional treatment of thyroid patients alone may not really be adequate to achieve this wellness. And that's what I'm going to do today. First of all, what is the thyroid gland? It's an organ located right here at the base of the neck, right up above the mid-bone of the chest, right here.
Yes, okay.
It's a small gland, and it produces chemicals called thyroid hormones that are released in the bloodstream in a continuous fashion and in a well-defined amounts. And there are two hormones, T4 and T3. They are rich in iodine, and that's the difference between the two. T4 contains 4 iodines, and T3 contains 3 iodines. And the most active form of thyroid hormone is actually T3. And T3 regulates, in addition to the functioning of almost every single cell in our system, it regulates neurotransmitters such as noradrenaline, serotonin, GABA, all these neurotransmitters that have been implicated in depression, anxiety, behavior, mood, and appetite. The thyroid gland receives messages from the master gland, the pituitary gland, and the hormone that represents the signal is TSH. Now, when the gland gets affected by the immune system, in fact, the dysfunction or an imbalance of the thyroid usually derives from an immune attack on the thyroid gland. The immune system gets disturbed, and it causes some interaction with the gland. And when there is little thyroid hormone being produced, we call this hypothyroidism or underactive thyroid. When the immune system makes the gland produce too much thyroid hormone, that's also an autoimmune attack, and it's called Graves' disease. So the most common, actually, autoimmune condition that results in dysfunction, in deficit in thyroid hormone, is Hashimoto's thyroiditis.
Yes.
And perhaps 10 to 15% of women have Hashimoto's thyroiditis. Many of these patients actually may never develop underactive thyroid, but a substantial number of these patients will experience low thyroid in the future. Now, thyroid imbalance, thyroid disorders in general, really are very, very prevalent in the population, very, very common. At least 1 in 10 Americans has
Oh, wow.
the thyroid disorder.
Yes.
That's at least 30 million individuals. Hashimoto's thyroiditis that I was talking about earlier affects 10 to 15% of all women. Hypothyroidism, low thyroid, affects 8% of the population, and it's primarily women, 8 women for 1 man.
Oh, wow.
We need to know also that at least 24 million Americans have low-grade hypothyroidism. By low-grade, that means the test
Yeah.
that diagnose hypothyroidism is minimally abnormal, but yet the impact of this condition may be quite
There's a
significant.
problem, yes.
It's a condition that really increases in frequency during the menopausal transition. And at least 10 million menopausal women actually have hypothyroidism. Too much thyroid hormone in our system, which is hyperthyroidism, is found in maybe 2% of the
okay.
population. And thyroid lumps that may be cancerous are found in 5 to 6% of the population. So it's pretty common.
Yes.
The tragedy right now is that many people have a thyroid imbalance. They have symptoms related to low thyroid or excess thyroid, and they are not diagnosed.
Yes.
And that's why I call it the hidden epidemic.
Yes.
One of the main reasons why people don't get diagnosed on time and may go on with their symptoms over years is that fatigue, stress, depression, anxiety are common symptoms of thyroid imbalance. But these symptoms are really quite common among the general population, and these symptoms may not be related to the thyroid. So when a person goes to see the doctor with these symptoms are dismissed as
It's
trivial
hidden, yes.
symptoms. So
Yes.
fatigue, depression, anxiety. Also, since it's a women's condition, quite often these symptoms are dismissed as generic female complaints.
Yes.
Sometimes thyroid imbalance also affects specific organs like the heart, the muscle, the lungs. And physicians and the patients may focus on that particular organ, thinking that this is the problem.
Yes.
It's not a systemic hormonal issue that is causing the imbalance.
They deal with the symptom rather than the root cause.
Exactly. So for that reason, you will see out there many people going on, having symptoms for years sometimes,
Yes.
and they don't get the diagnosis.
The proper diagnosis.
The proper diagnosis
Yes.
and treatment. What makes us develop an imbalance? What is the root of this epidemic? There is a lot of scientific evidence right now that the genes play a major role. Our genes are very important, are predetermining factors on whether you would have or not a thyroid imbalance. But that's not the only thing. Fluctuation of sex hormones, such as estrogens and testosterone, play a role as well.
Okay.
And perhaps that's one of the explanations why women tend to have more thyroid disease than others. There is a host of infectious agents that can trigger the immune attack on the thyroid gland, viruses and bacteria.
Yes.
And there are also toxins, toxic chemicals in the environment that may predispose and trigger and perpetuate the autoimmune attack on the thyroid. Also, the types of food that you eat. Too much animal fat, for example, has been shown, at least in other conditions, to alter the immune system and to promote autoimmunity. For the thyroid specifically, a lack of essential amino acids such as tyrosine, which is the backbone of the thyroid hormone molecule, may predispose a person or may lead a person to have thyroid dysfunction. Other vitamins are essential for the functioning of the thyroid gland and for thyroid hormones to work efficiently in the cells.
Yes.
They require these vitamins and antioxidants. We now know that vitamin D deficiency, it has become a biggie right now, Vitamin D deficiency can promote autoimmunity.
Yes.
There are two micronutrients that I really insist on. That's zinc and selenium.
Yes.
They are essential for the immune system support, as well as they are important for the functioning of thyroid hormone. Omega-3 fatty acids are also important. Iodine excess and deficiency can trigger thyroid dysfunction as well. In addition to these factors, stress is another overlooked element.
Yes. Yes.
Stress and the perception of stress can affect the brain chemicals, which affect the immune system, and the immune system will attack the thyroid, and will cause the imbalance.
Just a domino effect.
Exactly.
Yes.
Now, what about, I'm going to focus a little bit on the symptoms of hypothyroidism, low thyroid, because it's the most prevalent condition in the general population. Hypothyroidism can cause fatigue. Weight gain is an important symptom. Pains and aches in the muscles and joints, muscle cramps, constipation, dry skin, pale skin, feeling cold even in a warm environment, and lowering of defense against infections as well. Low thyroid can promote mental effects. One of them is depression. Depression is really quite common, in my opinion, in hypothyroid patients. Low thyroid can promote slowing of thoughts, increased sluggishness, sleepiness, forgetfulness, emotional instability, irritability, anger, loss of ambition, decreased ability to pay attention and focus. It also can be a cause of anxiety, panic attacks, mood swings. It can make mood swing disorders worse, like bipolar disorder and cyclothymia. Thyroid hormone, a normal thyroid hormone system is also crucial for preventing you from having a depression. If you have a low thyroid to start with, and you get stressed out and you are going to become depressed,
Yes.
the brain effect on the thyroid system will make the thyroid release more thyroid hormone to come to the rescue of low serotonin in the brain. So it's very important to have a normal thyroid balance. Now, low thyroid also causes hidden effects, long-term hidden effects, such as hypercholesterolemia, coronary artery disease,
Yes.
peripheral vascular disease, and damage to the brain and dementia. And these are the main effects of low thyroid.
Pretty dangerous, huh?
Well, low thyroid is overlooked, and if it's not diagnosed on time and treated properly, obviously it will cause long-term consequences.
Yes. Can you tell us more about the thyroid gland and women's issues, Dr. Aram?
Yes, thyroid imbalance affects primarily women. So women struggle with specific issues related to the thyroid. Yes. One of the most important issues is the weight gain depression cycle. Low thyroid promotes weight gain. You gain weight, you become depressed as a result of that. Depression related to the low thyroid, and it becomes really a big cycle. Women also tend to suffer from sexual problems when they have low thyroid or excess thyroid. Actually, they may have low sexual energy, orgasm problems, painful intercourse. Women tend to struggle with relationship problems that are generated by the mental effects of low thyroid, infertility issues, miscarriages, PMS and worsening PMS. Postpartum depression also. We know that 5 to 6% of pregnant women actually develop an imbalance after they deliver. Menopausal women are really at risk for having more symptoms when they go through the menopausal transition. The thyroid imbalance, the frequency of thyroid imbalance tends to increase at menopause. 12 to 14% of menopausal women experience underactive thyroid, and thyroid imbalance will make menopausal symptoms even worse. To test for thyroid imbalance, everybody agrees that the most precise and sensitive test is TSH, which is the pituitary hormone, the signal hormone that goes from the pituitary to the thyroid to makes it work. And low thyroid will make the TSH level go up, and too much thyroid in your system will make TSH level will go down. Now, I would like to spend a few minutes addressing the components of the mind-body program to the thyroid, the comprehensive program that I use to treat my patients. The main points, I should say the first step, first of all, is to diagnose early and correct the imbalance with proper treatment. And the patient should become a partner to the physician in this endeavor, midterm and short term. The thyroid level should be kept well balanced at all times with thorough monitoring, regular adjustment of medications if needed. I often use a combination of the two hormones that I talked about, not only the conventional T4 treatment for hypothyroidism. I add the right amount of T3 to treat depressive symptoms in patients who have persistent fatigue. Antidepressants and relaxation techniques sometimes are part of the program. Sometimes I instruct my patients to have counseling, to seek support from their partners, from the family. All this will make the immune system stronger and the emotional well-being better. Part of the program also is regular exercise, particularly mindful exercise. I advocate a low-fat, low simple sugar, higher protein, higher fiber eating plan.
Yes.
Patients with thyroid need to have their cholesterol and their blood pressure checked and monitored. I promote the use of antioxidants to get rid of the oxidative stress, vitamins, omega-3 fatty acids, avoid too much or deficiency of iodine, and address the hormonal issues that women may have in addition to the thyroid. Mm-hmm. Part of the mind-body program is also addressing the weight issues. Patients with thyroid imbalance, hypothyroidism particularly, experience slowing of metabolism, but also they have increasing craving for carbohydrates related to the neurotransmitters effects. People who suffer from hyperthyroidism tend to gain weight when their thyroid levels become normal. The components, the three major components of the weight management program is the thyroid eating plan, which will be low simple sugar, more protein, more fiber,
yes.
Regular exercise, vitamins and antioxidants, but also I often give some tips to my thyroid patients, including taking the appropriate amounts of selenium and zinc, and I have designed a combination of these essential vitamins and supplements for my thyroid patients. In addition to this, I often recommend using relaxation techniques as part of the program of weight management. I often ask my patients to increase the frequency of their meals, always eat breakfast, be careful with portions, meal portions, sugary drinks, control their portions when they go out to dine, increase the calcium intake. Omega-3 fatty acids, again, are important for weight management, and improve the way you manage stress. I think it's very important, as well as taking care of the sleep issues. And sometimes I recommend cognitive behavioral approach. This really gives you an idea on the different parts of this program to make patients feel better physically and emotionally. It's not just a matter of treating patients with medications and make the test normal again, but you need to address the patient as a whole,
yes.
so they can achieve and maintain that physical and emotional, mental wellness.
Yes, so total well-being.
Exactly.
Yes. What about Lugol's iodine and the thyroid?
Well, Lugol contains too much iodine, and sometimes it can be actually detrimental to your health. Too much iodine can affect the immune system and may trigger an autoimmune attack on the thyroid, so that may defeat the purpose.
Okay, well, thank you, Dr. Aram, for such valuable information. And to our viewers, don't miss our next show. I hope you enjoyed this one. Gem of the Caribbean is a Texas-based North Lake production.